Good morning, class. My name is Aurelio Calderon, and in my 7-minute informative presentation, I will give you more information about asthma and how it may risk severely due to COVID-19. After my 7-minute presentation, my classmates will know the following 3 things about asthma. Number 1, what asthma really is. Number 2, treatments for asthma. And number 3, how COVID-19 can negatively affect asthma. I will also share insights about how I'm dealing with asthma during this time. Just a couple weeks ago, I was having trouble breathing. I was so worried that I might have the coronavirus. After some checkups and tests, I was diagnosed with asthma. Today, I plan on giving more information about asthma and the increased risk due to the coronavirus. And specifically, the topics I will cover is what is asthma and treatments with asthma and how COVID-19 can negatively affect asthma. I have been diagnosed with asthma just a couple weeks ago, and since then, I wanted to learn more about it, and I will share with you guys what I've learned about asthma. I will give you my personal experience in dealing with asthma, and I will also show you the medications that I'm taking in terms of my asthma and how I'm able to control the symptoms. After my 7-minute informative speech, you guys will be more educated about asthma as a condition. You guys will get to understand and know more about people who's dealing with asthma, and this might help save someone's life in the future. And the topics, my research sources is from, I have 3 articles that I've wrote and researched, and the topics will include Muhammad Hashimi and Miriam Tariq's article titled Asthma that was published August 10, 2020. Another one is Elissa M. Abrams' Asthma and COVID-19 that was published May 19 of 2020. Another article that I've researched on that will cover my 7 minutes presentation is Alberto Papi, Francisco Blesi, Giorgio Walter, Luca Morandi, Luca Richeldi, and Aldea Rossi. Article titled Treatment Strategies for Asthma, Reshaping the Concept of Asthma Management that was published August 15, 2020. Now let's begin. What is asthma? And the information and statistics I'm going to be giving about this topic will be based on Muhammad Hashimi's article titled Asthma that was published on August 10, 2020. First, I want you guys to get familiarized with specific terms. Number 1 is the term inflammation. This refers to your body's process of fighting against things that harm it. Another is an environmental trigger. These are factors in one's environment that may play a role in causing asthma attacks. And 3 is pathology. It is the cause and effect, the study of cause and effect. Asthma is a common disease and has a wide range of severity, ranging from mild to life-threatening when it comes to the airway closure of your lungs. Asthma is more prevalent among children and it is a condition of acute and fully reversible airway inflammation. Usually following an exposure to an environmental trigger, asthma attacks begin with the inhalation of an irritant in forms such as cold air or pollen. Asthma is a disease in that it's considered to have a multifactorial pathology that is influenced by both genetics and environmental exposure. I'm going to be talking about the statistics that deals with asthma. Asthma affects around 15 to 20% of people in developed countries and around 2 to 4% in less developed countries. Asthma is more common in boys with a male to female ratio of 2 to 1 until puberty, when ratio becomes 1 to 1. And up to 50% of children with asthma has a decrease of severity or a disappearance of symptoms during adulthood. 66% of all asthma cases are diagnosed before the age of 18 years. Now let's have a general understanding of what asthma is and how it affects the individual with the condition. Let's talk about the treatments for asthma. With this topic, I will be using as a guide Alberto Papi, Francisco Blasi, Giorgio Walters, and Luca Richeldi and Andreas Rossi article titled Treatment Strategies for Asthma, Reshaping the Concept of Asthma Management, that was published on August 15, 2020. Let's talk about possible treatments for asthma. Asthma is a medication. Asthma control medications reduce airway inflammation, and these medications help prevent asthma symptoms. One type of medication is called an inhaled corticosteroid, which is very common in treating asthma. This medication acts as a quick relief medication that eases symptoms rapidly. This is what I use for my asthma, and this is a fast-acting inhaler. One type of asthma medication is called short-acting beta antagonist, or SABAs. It is considered by national guideline to be the recommended first-line treatment for mild asthma. It acts as a rapid symptom relief. Some drawbacks is it is ineffective in controlling the inflammation progress on your lungs, which is the main cause of what is called. Another medication I'll be talking about is the long-acting beta antagonist, or LABA. This is the medication I use. It is a daily maintenance medication that I take daily that has a longer effect when dealing with asthma. It is considered to be used for maintenance, and it can also be used for rescue inhaler when symptoms arrive. It can be used as needed and can be used as maintenance for mild to severe asthma. There are different kinds of medications you can use for asthma, and they vary depending on your needs and what your doctor may recommend. So on my third and final point, let's talk about how asthma can affect COVID-19 patients. And in this topic, I'll be using Elisa M. Abrams' article titled Asthma and COVID-19 that was published on May 19 of 2020. Asthma has been considered to be a risk factor with those affected by COVID-19. And there are many similar symptoms with COVID-19 and asthma, which is why a couple weeks ago I was so nervous. I thought I had the coronavirus. And after the several tests and appointments with my doctor, they diagnosed me with asthma. I also got my COVID testing done, and it came back negative. We've learned in my presentation that COVID-19 and asthma has many similar symptoms, and it's tricky to identify it because of that. Now let's recap on what we've learned so far in this presentation. Today we've learned about what asthma is, and the ways and types of medication that's used to treat asthma, and why it's so risky for asthma patients during the coronavirus pandemic. Let's stay safe and use proper protective equipment when going outside and follow the protocols for our safety. Thank you.